Hi, everybody, and welcome. My name's Lauren Gilman. I'm one of the technical assistance specialists, and I'm the topic lead for bullying prevention for the Child Safety Learning Collaborative of CSN. Glad you all could join us today. I'm here with two colleagues from CSN, with Jenny Stern-Carasone, whom most of you probably know. She's one of our other topic leads, and she's also the director of the CSLC. And I'm also here with Shannon Reynolds, who's our tech person for today, kind of behind the scenes. So thank you so much for joining us, and thanks to all of you who've been typing your information into the chat. I see that somebody really likes Halloween, and some people are waiting for cooler weather, and some people have cooler weather. I always like seeing what people say since we've got people from all over the country. So welcome everyone. Please feel free to keep typing into the chat. And I think we're going to go on to our next slide. Just so you all know, we are funded. The Children's Safety Network is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. We always just say this at the beginning, this disclaimer at the beginning of all of our events, that the information or content or conclusions are those of the author and shouldn't be construed as the official position or policy of HRSA, HHS, or the U.S. government. Um, Next slide, please. So we are really looking forward to an engaging participatory event today. We always try when we present information in these state technical assistance webinars, we want it to be useful and valuable to all of you. And there's always going to be times for you to talk to each other. In fact, today we're going to have some breakout groups. So we're looking forward to everybody being engaged today. If you need closed captions, you can view them by clicking the CC button at the bottom of your screen. As you probably heard when you came on, the session is being recorded and it will be posted in the CSLC web portal after the event. Um, and it would be great if you could turn your camera on to facilitate our engagement. You don't have to do that the whole time, but if you're able to, we always appreciate, we like seeing people's faces. But there will be breakout rooms, and hopefully at that point you'll be able to turn your camera on. And we like it when people stay muted when they're not speaking, but you do have the ability to unmute yourself whenever you want to say something. So we're looking forward to that. Um, Next slide, please. So these are our guidelines for this event and for all of these events. We just ask people to be present, bring a curious stand, and be partners. As everybody who's part of the CSLC knows, our motto sort of is I'll teach, I'll learn. So we want everybody to work together in learning, to honor each other's perspectives and just take care of yourself as needed. This is just an hour-long event. Um, so why don't we go on to the next slide? So actually today, this is an all CSLC event. Well, I mean, in terms of our CSN presenters. So first, Jenny is going to speak a little bit about quality improvement, and then I'm going to give a little bit of a piece of it, and then we're going to go into some breakout rooms and have some opportunity for discussion. And as you probably all know, Jenny is the CSN Associate Director and also the Director of the Child Safety Learning Collaborative. She's been doing this work for quite a while. Oh, and thank you. Before we start doing that, we would like everybody to answer this poll. It'll just take you about 30 seconds. We just need to know what type of organization you're with. This is something that our funder really likes to know from us. So we'll just give you guys like a little bit more time. Looks like most of you have participated. Just a couple more seconds. I see people are still participating. Great. Okay. Well, thank you very much. I think we can end the poll right now, and I will turn it over to Jenny.
Fantastic. Thank you so very, very much. Welcome, everyone. Again, this is a state technical assistance webinar, and as Lauren said, the intention is to engage. So we are going to do some sharing out, but we really want to hear from you as well. So let me start by sharing a little bit about CSN. I know many of you are familiar with Children's Safety Network, but perhaps some of you are not. Our mission here at CSN is to ensure that all children are safe and healthy with supportive and nurturing environments. And we do that by supporting Title V agencies to advance evidence-based policies, programs, and practices at the state and local levels in order to reduce fatal and serious injuries among infants, children, and adolescents ages 0 to 19. One of our key components within CSN is our Children's Safety Learning Collaborative. This is an unprecedented opportunity for Title V programs in states and jurisdictions to collaborate with one another with the aim to advance evidence-based policies, programs, and practices at both the state and local level in an effort to reduce fatal and serious injuries amongst infants, children, and adolescents. The CSLC employs continuous quality improvement as a means to help teams accelerate their work and results. And as you can see here, we're currently working on these 4 injury topics in our learning collaborative. Many of you are members, and we look forward to hearing from you. And these are some of the comments and feedback that we've heard from people in the collaborative. I want to start, though, because quality improvement is one of the key focuses of our state technical assistance webinar today. And I want to get a sense of everyone's understanding and interpretation of what this is. So please add your thoughts to the chat or raise your hand or just unmute and call out again engagement. What are some examples of quality improvement in your work? Or maybe if not in your work, can you think of some quality improvement examples in your life? Or how would you describe quality improvement to someone who might be less familiar? So I'm going to give you a moment to think about this. I know quality improvement is a buzzword. It gets talked about a lot. Terry, getting better little by little. Very good, yes. Using results-based accountability to improve key measures for our programs. Ooh, Jessica, I love that. Results-based accountability, I love that. PDSA cycles, yes, Joanne, yes, indeed. PDSA cycles is a key tool utilized in the quality improvement. Shannon's dittoing Jessica. Yeah, it was a very well-written explanation. RBA. Shannon, would you mind unmuting and just sharing the RBA framework?
So with the RBA framework, it's looking at, and I'm just learning. So this is a new position for our nonprofit, but with from my understanding with the RBA is that it's looking at population versus performance standards and setting realistic, looking at indicators and using realistic indicators to enhance the measures. And I'm probably totally getting off on this, Jessica. You could, if you want to jump in and help. Yes, please.
Yes, yes.
I just started learning about it, so I'm going to let
great.
Jessica, she's probably more of the expert on it.
So I think about 3 big questions. How much did we do? How well did we do? And is anyone better off? So those are the frameworks, I guess, for thinking about how are you assessing quality and what change did you actually make? So then from there, you can like turn the curve is kind of the phrase in the method.
Excellent. That's excellent. Thank you for sharing that with us. And you guys have provided an excellent example of there are many different frameworks and approaches to quality improvement, but it all comes back to that ability to have informed accountability and a measurable means to determine an improvement and making that turn. So that's really helpful. And I see a couple other from Daniel and Sim about other uses. So thank you for sharing that. For the purposes of our conversation today, I'm going to build on the definition of quality improvement as a structured, data-driven process that's used to systematically enhance services, programs, or systems in order to better meet goals and outcomes. This is requiring a systematic approach that uses continuous actions that lead to measurable improvement, with an emphasis on measurable, in order to ensure that efforts are effective, meet the community need, and most importantly, are making an impact, right? That's what we want to do, is an improvement. Too often, a barrier to quality improvement efforts is a fear of failure. But the advantage with using quality improvement, as Terry said, little by little, is that you're testing on small scales, and then you're able to learn in a safe, thoughtfully planned manner, and thus hopefully avoid any sense of failure. So why would we even consider quality improvement in child safety? Well, we know that injury is a leading cause of death for children ages 0 to 19, and many of these deaths are preventable. Furthermore, public health is a complex system with many factors, cross-sector partnerships, political influences, funding challenges, high staff turnover, and quality improvement is about process improvement and bringing new and existing knowledge into your daily practice, thus providing a means to accelerate change through the use of evidence-based and evidence-informed strategies and small tests of change. We're going to talk more about that today. As a systematic approach, it's really about understanding your system, what improvements you want to make, and then measuring as you go in order to continuously inform your process so that you can adapt, adopt, or abandon the strategies in order to move towards improvement and success and away from failure. So we know that in any goal-oriented work, when you're planning, you need to know where you want to go, right? I mean, a trip, anything, but you also need to know what you want to do. So employing quality improvement as a systematic approach, it's important, therefore, to measure progress as well as to establish a clear time frame and to have dedicated resources for the journey. This is important both for motivation and sustainability. So here at CSN, we have developed and tested over the last 10 years our CSN framework for quality improvement. And this focuses on building public will and state jurisdiction capacity in key areas essential to achieving sustainable and scalable child safety results. So I think we've posted a link to the resource that we have available for free on our website. And the cornerstones, as you can see in the framework, are identification and use of data-driven, evidence-based, and evidence-informed strategies and programs in order to improve child safety expertise, the development of leadership and management practices and skills, an ongoing commitment to shared learning and principles that are drawn from advances in improvement and implementation sciences in order to achieve systems improvement. So what we've seen in our experience is that with a focus on these three cornerstones, we can see improvements in both workforce development, which includes capacity and knowledge and the ability to put these into practice, and also improvement of the child safety system development, which is seen in measures such as maybe the number of students that are receiving teen driver education or the number of organizations conducting suicide screening. And all of this then results with a potential to then contribute to positive health impact. The CSM framework is supported by the Associates in Process Improvements Model for Improvement. This may also be familiar to many of you. This model centers on clarifying the aim. What is it you're trying to accomplish? And then determining the changes that you think will result in an improvement towards achieving the aim and the data you're going to collect and analyze in order to know that the change is actually an improvement and not just a change in circumstances. Again, this may be familiar, but quality improvement is data-driven, but data alone does not result in a change. So just measuring something, if it's not the right thing, isn't going to tell you if you actually are moving towards the improvement that you want. For example, if you're trying to grow a prize cow, you might weigh the cow every day and see if it's getting bigger, if it's gaining weight. But even though it may be getting bigger and gaining weight, if you're not implementing and monitoring your changes, you may not be getting the improvement that you actually want, which is to have a prize cow. The cow may weigh more, but it may lack muscle development or overall health because you hadn't been tracking how much you were feeding it or the type of food that you were feeding it or whether it was getting exercise. So just by collecting data for the sake of having data, but not implementing evidence-based change ideas will not be an effective means to achieving your improvement. So I want to hand this over to Lauren, who's going to now talk to us about some QI tools that we can use to implement this process.
Great. Thank you, Jenny. Hope everyone can hear me okay. So yes, as she said, we're going to talk about some of these tools. A quick shout out to Claire Grace Jones, who's not here today, because I do love the pictures that she chose for this slide. So the one before, anyway, you'll see it when you get the slides. So there are many ways to focus on quality improvement. And here's the model that we're sharing that we're going to be talking about today. There are, as you all kind of talked about earlier, there are different models and different ways to look at it, but the principles are basically the same. And so what we're going to go through each of these steps in more detail as we go through, and we're actually going to give you a chance to practice some of them. But just as an overview of the process that we're going to be going through, the first thing is always to define the problem. You have to know what it is that you're trying to change. What are you trying to address here? Then to create an aim statement, and we're going to go through a few examples of aim statements which have particular parameters to them. And the next step would be to identify drivers, and the drivers are the factors that contribute to achieving your aim. And then after that, you're going to identify ideas to test. Those are in within the context of the CSLC, what we call our change ideas. These are, what we mean for CSN is evidence-based or evidence-informed strategies, programs, or practices. And we'll talk more about that when we get there. And then finally, one of the things you could do as part of this quality improvement process is implement a plan, do, study, act cycle as a way of testing out some small changes. So next slide, please. So the first thing to do is to clearly identify the problem. In a data-driven way, identify why the issue that you're trying to address is a problem. Frame it. Like, why do we care about this issue? So it's not just that parents aren't able to access infant car seats, it's that the babies are at risk because there are no car seats. Make that connection. Even though if it might seem obvious to you, honestly, it isn't obvious to everyone, and it isn't obvious to all of the different audiences out there who you might be working with. So make the connection. Create that problem statement in partnership. Think about the other people who are involved in the work and those who are impacted by the work. Identify the why and then create a statement that's clear and concise. So now let's go on to the next slide. And here are a couple of examples. And what we have here are one example that's more kind of daily life and another example that's more connected to our work. And we're going to be working through all the examples of all the steps of the QI process, specifically using these examples. So the first one is about Jake. The problem statement here. So this is actually showing us that we can do this QI process with lots of different things in our lives. It doesn't have to be something super scientific or directly related to the data we have for our work. This quality improvement process is effective and useful in so many different pieces of our lives. So here's the problem with Jake. Jake is not independently completing his weekday reading. And why is that important? Well, it's important because it's impacting his learning and his grades and also his mother's safety. His mom's sanity, not safety. Hopefully not safety. So that's an example of a problem statement. To look at a problem statement that's more directly related to some of our work under the CSLC, specifically the sudden unexpected infant death. The problem there is that rates of SUID among Black non-Hispanic families persist at higher rates than white non-Hispanic families. And so that's a problem that we're trying to address. So why don't we go on to the next slide? Because now we're going to talk about how you create an AIM statement. And this is something that we're going to show you a few examples of AIM statements. But an AIM statement is a written, measurable, and time-sensitive statement of the expected results in an improvement process. It's what you want, where you want to go with this process. AIM statements are written in a SMART format, and that acronym means that they should be specific, measurable, attainable, relevant, and time-bound. So as you're creating your AIM statement, consider the following. Think about, what do you want to achieve? Where do you want to get to from this point to the end? And then for who? For whom? Who's going to benefit from this? Is it children in a particular area? Is it caregivers? Is it kids adolescents in a particular school? Is it the entire state? What do you want to achieve? Who's going to benefit? And by when? When will it start? When will it stop? And then by how much? What will the change be? And how are you going to measure it? So that's what you need to think about when you're thinking about your AIM statement. And I think it'll be kind of fun to see how this kind of AIM statement plays out when you're talking about the Jake example. So why don't you go to the next slide? So for the Jake example, we're giving an example of AIM statements related to the problem statements that we just shared, right? So here's the AIM statement for the Jake problem statement. By December 31st, Jake will independently read for 20 minutes each weeknight before bed, as shown by his reading log, completing at least 4 out of 5 nights for each week in December with no reminders from mom. So think about, who will this benefit? Well, it'll benefit Jake. Who else might it benefit? Hopefully you're all thinking the same way I am. It'll benefit his mother as well. By when? Well, we have that right here, by December 31st. And by how much? Well, it's very clear here. We want him doing this on his own 4 out of 5 nights on weekdays. So it's all quantified and really clear. So we know exactly what we're aiming for. A parallel example in the SUID problem statement: by June 30th, 2027, we will reduce the gap of SUID deaths between white and black non-Hispanic infants from 5% to 3%. That's the amount of reduction of the amount of the gap we're going to reduce the gap from 5% to 3% according to DPH annual maternal and child health statistics reports. So that's a way, again, to use who will it benefit, by when, and how much, and to really quantify and be really clear on what we're trying to accomplish. So why don't we move to the next slide? So in order to identify what the change ideas are going to be, like what you're actually going to do to make this happen, you really need to know more about the root causes of the problems that you seek to address. Because solving problems are not one size fits all at all, right? Like there's lots of different ways you can do things, and you really have to know more about, this is the thing about data. Like if you have quantitative data, you know the what, but you really need to get to the why here. So what is one way to get to the why? Well, one of the ways you can get there is by using this 5 whys worksheet. It's a handout that Shannon just put, or she hasn't yet, but she's going to shortly put in the chat that you will all be able to download, and then you'll be able to work on this in small groups. So let's go. So just to give you let's just go to the next slide really quickly so you can see what it looks like. So what you're going to do in your small groups is put the problem statement under the define the problem, right? And actually, Shannon just put one of the problem statements, the Jake one, into the chat. And then what you need to do is really think through, why is this happening? And try to get deeper with every why. So, okay, Jake is not reading on his own. Why is that? Okay, and if you come up with a reason, then why is that? So we're going to ask you to get into small groups, and we're going to give you about 7 minutes, I think. Is that right, Jenny? To work on this. So, does anyone have any questions? Is everyone able to access the 5 Whys worksheet? If anybody can't access it, raise your hand. Let us know. I don't think everybody's going to need it, but actually it would be great if everybody could access it. I think the thing to do will be to ask somebody in your group to be a scribe and to write this down as you're talking about it. So I think right now you're going to be whisked away into your random groups. So please have a good conversation. We'll be excited to hear what you come up with when you get back. Hi, everybody. Welcome back. Why don't we give people just a couple more minutes to come back to the main room? If you have any background noise going on, please mute yourself. So it looks like let me wait till a few more people come back before I say anything. Now they're all coming back. They're flooding back in. Okay. Hi, everybody. Thanks for returning. It's good to see you all. If you are someplace with background noise, please remember to mute yourself so we don't hear your background noise. And I wanted to apologize because we gave you a 5 Whys worksheet that was already filled in. We meant to give you a blank one. The filled in one was just supposed to be our internal example to make sure that we had some good suggestions if people didn't come up with them. We know that you would have come up with fabulous ideas and all of these whys all on your own. So we apologize for that, but we do want to know what happened in your conversations. Did you talk about this? Did you learn anything? Did you come up with any other whys? Did you talk about how this process could be useful, not just about your home life, but also about work? Joanne, yes, please.
I was the note taker for our group, and we kind of ran out of time, but we went down the path of problem statement. Jake doesn't complete his required reading. And the first why is he's not being encouraged by his parents to read. Why? They have multiple jobs and they're busy. Why? The parents don't understand the value of Jake's education towards improving his future. And then the next why is because the parents might have low educational attainment themselves. So we're bringing this poor guy down into maybe a low income family who's just too busy to think, and probably think Jake is going to be working retail the rest of his life the same way they do. So what's the root cause? Perhaps the root cause is low income family just too busy to help him with his homework.
That is really interesting. That's not the that's a different direction, and it's very valid, and it's a very important a different way of looking at things, but you really are looking at I'm thinking of the socio-ecological model. And so it's not just the kid, it's the whole system around this young person. So that's a really interesting way of looking at it. Like it's not just him, it's the situation, what the parents' struggles are, and their own lack of really making the connection between reading every night and success in school and future success. Um, any quick final comments before we move on to the next section? But thank you so much for sharing that. And I hope knowing about this process will be helpful as you think about the root causes of what's going on in your communities and in your states, and then plan for your own change ideas. I am going to turn it over to Jenny now. Jenny, you can start sharing your slides again, and we're going to talk a little bit now um, about the driver diagram.
Yep, absolutely. Thank you all for working through that. And hopefully the intent of the tool was to, exemplify just a resource to just help you go through kind of this thinking process. So Jake is just one example that we're using. So now that we have a sense of the root causes and barriers that might exist in Jake's scenario, we want to now determine what potential changes that you might test in order to improve his situation, and the measures that you would track in order to know if the improvement is actually the improvement you're seeking. So another tool that you might use is a driver diagram. And at CSN, we use driver diagrams in our Child Safety Learning Collaborative. We have several of our previously tested and utilized change packages, which are the driver diagrams for our prior cohorts, available on our website. You're welcome to go and check them out and use them. We encourage you to do so. A driver diagram shows the relationship between the overall aim, which we talked about earlier, and the drivers that directly contribute to achieving the aim, such as a driver of having strong partnerships across your state. And then the specific change ideas that lead to those drivers, such as educating policymakers or expanding a coalition of child safety experts. In practice, change ideas are evidence-based or evidence-informed. So what we're going to do today is we're going to go back into those same breakouts for about 7 minutes again. And you have a blank sheet that should be going into the chat now, that we're going to have you brainstorm some drivers and change ideas that you might use in order to improve Jake's problem situation. Again, this is a little different scenario, so don't worry about the evidence-based aspect of it. We just want you to come up with what you think is evidence-informed, evidence-based in your own mind. And again, I've filled out the aim here for you. So take a moment, again, have someone download the tool, be your note taker, and we'll come back again. You only need to determine primary drivers and change ideas. So you'll see there are secondary drivers in the form, but for today, just go ahead and do primary drivers and change ideas. Okay, great. Looks like folks are coming back. Thanks, everyone. So again, let's spend a moment and just hear from, one or two of the groups about, what you talked about and any drivers or change ideas that you came up with. You're welcome to just unmute and share, throw up your hand. Anybody run into any particular challenges? Did anybody come up with a driver or a change idea?
The
Go ahead, Shannon.
challenges that we talked about was just kind of lack of information, and talking about how we could really kind of go in many different directions of trying to think about some possible drivers to help Jake. So we kind of talked about those challenges of not having all of the information.
Yep.
So we were kind of just picking and choosing. So we just picked one, and we kind of went from there.
You want to share what that was?
So we talked about support and then supplies as our drivers. So availability of supplies and then putting supports in place for Jake. So some of our change ideas were differentiating the reading log to and engaging Jake in the process to get him more motivated and to get that buy-in, assessing for possible learning disabilities, connecting with the classroom teacher to identify difference. So this is my forte right here. Not the RBA, I got it, but this is my forte. Building that connection with the teacher to identify ways to support Jake with his reading at home. Bookmark timers, setting an alarm, designating a specific time to do it, designating a distraction-free zone. We also talked about maybe Jake doesn't have many books that are interesting to him. So doing like a book survey of of topics and books he may be interested in, and then providing those resources. So
Great. I'm going to take that last one that you just did. I love the way that you broke it down into supplies and support, right? Great drivers, primary drivers. And then you had such a wonderful array of change ideas. And even in that last one, you took yourself to that next level of like, okay, maybe he doesn't have enough array or diversity of books that, would interest him. And then you actually just elicited a potential strategy that you might implement as a PDSA. So that was fantastic about doing a survey with him to try and understand what his interest area were, and then taking that information and being able to then go out and perhaps resource some additional books, and then test those with him to see if that might help improve his independent reading. So that was fantastic. I would love to hear from other people, but I do want to make sure that we have time to finish up and hear a little bit more at the end from folks. So I'm going to spend a moment to get myself back on track with sharing slides. That was fantastic. And thank you, Shannon, for you weren't even a plant, but you did a great job there. So we used the Jake example because we were hoping that regardless of whatever injury area or work that you do, that was something that would potentially be accessible to everybody. But I want to just come back around in the arena of public health to the SUID example. So in the SUID example, again, we had an aim of by June 30th, 2027, we're going to reduce the gap of SUID deaths between white and Black non-Hispanic infants from 5% to 2%, according to the Department of Public Health Annual Maternal and Child Health Statistics Report. And as Lauren illustrated earlier, this is a very appropriate, smart aim. We set a goal, which is a more time-bound, specific goal in order to achieve that aim, that by February 20th, 2026, we're going to increase the number of partners providing community-tailored safe infant sleep education and resources to parents and caregivers from 3 to 25, and this will be measured by completion of a quarterly partner questionnaire. So as we think through the drivers and change ideas, one driver in this situation might be to create families and caregivers who are knowledgeable in SUID prevention. And a potential change idea could be that we would provide education to natural supports, those people who are trusted adults or individuals and groups that are able to influence the lives of parents and guardians. And they could include grandparents, aunts and uncles, or other infant caregivers, and then be able to provide safe infant sleep practices and resources for parents and caregivers. So when we look through our root causes behind the problem, we've identified that reaching natural supports can be very challenging. But it happens that we have somebody on our coalition who lives in the area that we're trying to reach and might serve as a means to reach natural supports, in particular grandmothers. And we're looking again to strive for that goal of increasing the number of partners providing community-tailored safe infant sleep education and resources from 3 partners to 25, as measured by the completion of the quarterly partner questionnaire. So we're going to test a strategy of engaging salons as partners to see if this might be an effective way to reach the population. So now we've got this all determined. We're going to now operationalize it, where we're going to determine, clarify the change and determine a measure that's going to ensure that we know if we're actually achieving our aim. So here again, we're providing education and natural supports. We're trusted individuals and groups that are influential in the lives of parents and other infant caregivers. And our measure is going to be the number of organizational partnerships that engage with natural supports to promote and spread best practices in infant safe sleep. So this measurement strategy is based on the theory of change that a culture of prevention supported by organizational policies and procedures, rather than just the increase in numbers of individuals educated or educational materials distributed, is going to lead us to a sustainable reduction in injuries and fatalities. And our goal is that we're going to try and structure 22 new partnerships. So we've talked about the PDSA, and we're not going to go deep into the PDSA today. We just don't have time. That will be another future event. But again, quality improvement, you're conducting small rapid tests of change, and the PDSA cycle enables you to utilize trial and learning by tracking your experience and using real-time data, quantitative and qualitative, in order to inform your work and help you determine if you should adopt, adapt, or abandon an approach. They are truly about scale. The scale of the test is determined by the degree of belief that a change will lead to improvement and the cost of failure. So the greater the cost, and less likely for a change is going to result in smaller tests until you have that assurance that achieving your objective, and thus it's going to be worthwhile to invest the necessary time, energy, and resources in order to implement and scale up your approach. Again, looking to practice in safe environments where you can learn and avoid failure. PDSAs can be about anything. Example might be that you could do a PDSA to learn about the best ways partners are going to work together. You could test an in-person and virtual way of working together, look at the data, study it, and then it may be that you determine that you're going to try a hybrid approach as a result of the learnings and lessons that you got from that. I want to turn back to the example of using the PDSA on testing our salons. In this one, we're looking at using salons as a means to increase reaching natural supports. So you want to test this on a small scale so that you can learn in a safe environment. You might break your work down into smaller, more manageable timeframes. Again, we're working towards February in 2026, but in the next 90 days, we set an aim that you're going to reach 40 grandmothers in a predominantly Black, non-Hispanic community with a campaign that's distributing through beauty salons in order to increase safe sleep behaviors as measured by the questionnaire. So then you set out these steps, and one cycle might be to choose a single salon as a pilot site and roll out your education campaign. Then you collect your data on how the educational materials were received and how many natural supports you reached. Then based on the results, you decide on whether you're going to continue this strategy in more areas, more salons, or you may learn that it wasn't as effective as you wanted it to be. So you go back to your partnerships and you explore other ways that you might be able to successfully reach natural supports. And again, this is a really brief overview of the use of PDSAs. We've shared in the chat a couple of tools to help think through PDSAs, and we'll work on this again at a future state technical assistance webinar because it's always quite the adventure. I want to hand this back to Lauren for the last few minutes that we have together to really hear from you about the work that you've done and how QI is being utilized in your environments.
Thank you, Jenny. Yeah, this is just a time for us to really talk with each other here. Jenny, thanks for putting some of the questions in the chat. That was what was on the last slide. But I just want to hear from people. What QI tools have you used and have you found helpful in your work? Maybe you could share an example of something that you've done. So does anybody have any tools that you've used? Thanks, Terry. Thanks for coming. Or any a process that you've used? And also, we'd like to hear if you faced any barriers or if you have any tips for anyone else. So, what does quality improvement look like for you? What are some tools that you've used and how's that worked for you? You can raise your hand, you can type in the chat, you can just unmute and speak up.
Just a reminder that, we talked about some specific QI tools today, and these, are maybe familiar to you, but there are many other ways to do quality improvement. I mean, Shannon and Jessica shared another approach. Joanne, I know from our work with New Hampshire in the past that you've used like the fishbone approach and some other ways to really break down your work. So we'd love to just hear about quality improvement, whether it's using these tools and any successes or challenges that you've faced. Teresa, you've used RBA. Go ahead, Joanne.
I hate to say I'm in the middle of multitasking because we're doing a contract RFP. So I was just commenting on a comment that says, anyways, so
Welcome to the world of public health.
I've been here for 20 years. It never changed. But anyways, I've taken a few courses on like PDS. Well, I'm a lean yellow belt, which I got that maybe 10 years ago. So I don't remember all the steps, and I've taken some QI training, and they all use these formats, the fishbone, the 5 whys, SMART objectives and all that kind of thing. And the tool I use the most is making sure I have SMART objectives when I'm doing strategic planning. Most of the PDSA and other types of work happens in my head almost instantaneously. So it's hard for me to document them or to bring my partners through them. I just say, here's the end product. Here's the steps we need to do. Let's make a Gantt chart. And I'll just let you know if things are working or not.
But yeah,
which is kind of unfortunate because when I do need to slow down and actually document a PDSA cycle, I feel like it's just slows me down too much because I work so rapid fire. But it is an excellent tool, and if you're working on a grant that requires documentation about your evaluation processes, it's good to have these things documented. So I don't want to naysay them, but it slows down my personal processes for the way that I work.
it sounds like it really depends a lot on the context and on what's going on, because sometimes you need to be able to work really quickly, and sometimes you need to document so that people who don't have as much experience as you do understand how the process works, that they'll be able to do it when they're responsible for something. So I think being able to, when you need to do it quickly, is great. And then when you can slow down or do a debrief, or just, there are times that I think it's really beneficial to like take, to break it down that way, because you also might discover things that you hadn't, like there might be steps that you hadn't thought through as thoroughly that you could if you like slowed down and just jotted it down as steps. So yeah, I think what Jenny said is true, and ensuring that others can replicate our work and learn the lessons from our valuable, like you have really valuable experience and you know what you're doing, and there are people who are just coming up who could probably benefit a lot from that.
But I've been doing this since I was a new baby public health employee. It's like, this is how it's going to work. Get her done.
Mm-hmm.
But
thank you for sharing.
I'm a bad person to ask how valuable these tools are because they just happen automatically for me.
And Teresa just shared there's a book called Trying Hard is Not Good Enough. That's a good primer for RBA. So thank you for sharing that. Thanks for sharing a resource. Any final resources or anything that people want to share before we wrap up? Yeah, go ahead.
There's also a book after that called Turning the Curve, and the author is Mark Friedman. I just got done reading both of them. So
I'll put that in the chat. It was Turning the Curve. Okay, thank you very much. Okay, so we're just going to wrap up now. Here are some additional resources. You will have access to the slides when we post the recording and the slides to our web portal. We would greatly appreciate to get some feedback from people. So there's a link in the chat that you can use. We really do use this feedback so we can plan even better events in the future. And we did want to share just the dates of our upcoming state technical assistance webinars in December, February, and April. And we are planning a public webinar, a large webinar on the topic of playground safety, and that date will be announced soon. And we also have topic calls coming up in November. So we hope that all of you will join on the topic calls for your respective topics. And if you would rather use the QR code to fill out our evaluation, you could easily do it that way on your phone, or you could just click on the link that's in the chat. So I'll give everybody a minute to do that. And I want to say thank you very much to all of you for participating today. I think it was a great conversation. I hope you found some of the tools to be useful. As we said, there's a lot of different options. And I hope that having the chance to talk to one another in breakout groups was was useful for you as well. So thanks and have a great rest of your day.